Thank you very much. It's fascinating to listen. I'm only sorry I didn't get here to hear more of your excellent talk. Thank you very much for your time. I'm conscious that these agendas are really, really busy. You need solutions and you need answers to problems, not problems. So by the end of this 30 minutes, there's two great things that happen. One, you get your coffee at the end of the 30 minutes, which obviously is pretty good. And secondly, I hope you will find, as many other practices have found, that what I'm going to talk about will provide you with a simple, cheap, i.e. free, solution to meet all the friends and family test needs coming up in December. Also, it will tie back into what you last heard about a really powerful, simple and effective way to continually collect experience of patients and their carers in a way that meets a big part of Steve Field's and the CQC's objectives in continually listening to patients. So the aim by the end of this 30 minutes is solution to the friends and family test, and I'll have a quick discussion about what that is for those who don't know. An important part of meeting your obligations and expectations in terms of CQC, but much more importantly, it's about a solution and a tool which helps you deliver better services for your patients. Because yes, we absolutely have to meet the regulations, we have to meet the targets, we have to meet all our contractual obligations, but none of you really went into practice management for that. And similarly with your clinical colleagues, it's about delivering a superb service to your patients and their families, and it's about knowing when you've delivered a great service and being really clear about that, because that builds morale, and also really quickly and effectively knowing when things aren't right. Not streams and streams of complaints letters, but being much more responsive organisations. So that sounds like a bit of a big sell. I can tell most of you are thinking about the bit at the beginning about your coffee. So I'm going to speak quite fast, leave time for questions, but please interrupt. And Peter, your point about making sure I was here on time, I was really conscious. If you miss your GP appointment, you wait an hour. So if I had missed this, so little bit of tiny bit of context, because you've never met me. So. By training, I'm a nephrologist. I trained in Nottingham originally, then I was in Oxford, then I was in Boston, then I was back in Oxford. 1998, whilst carrying on being a clinician, I set up something called DoctorsNet UK, which was an online community, knowledge sharing and education for doctors. That grew into the world's largest community, but as my wife, who was a nurse, reminds me, it might have been the largest, but it wasn't the most valuable. You know, keeping the focus. The reason I mention that is I have a background and an experience of a sort of decade back to 2008 of healthcare and running internet businesses. In 2008, yeah, God, time flies, I exited out of that business and used the little bits of funds we made to set up an organisation called I Want Great Care. I Want Great Care 6 years ago, so long before the Friends and Family Test was even a glimmer in the Prime Minister's eye, long before the CQC was reorganised and got so much better than it used to be, long before the Francis report, Mid-Staffs, the Keogh report, etc. We set up this organisation with the aim of making it very simple for every organisation providing care and individual clinicians to get continuous feedback from their patients. And that doesn't mean a big clunky surveys, that doesn't mean sampling a few patients, that means basically moving healthcare into where the rest of society is, i.e. everybody who uses the service can and should rate and review the care they get, the service they get, because the vast majority of what you and your colleagues do every day is fantastic. The majority of patients get great care. They get empathy, they get kindness, they get efficiency, they get excellent clinical outcomes. Not everyone. And obviously, it's really important to highlight when things aren't right for all sorts of reasons. But I think it's equally important to highlight when things are fantastic and to highlight excellence. Because you know what happens if you have a complaint system? And organisations whose job, quite rightly, is to point out when things aren't right. Well, you combine organisations that tell you what's not right, you have complaint systems, and staff morale goes down. How do you all feel when there's another complaint? And it happens to even the best organisations. Staff morale goes down. Partly because people feel they've let them down, but also because you know that's not always a fair reflection of the entirety. So the good news about what we do, but also the Friends and Family Test, is it increases morale. Now, I'm expecting people to start throwing things or look disinterested or go and get their coffee. How can another bloody bureaucratic data collection survey thing increase morale? We have enough of those. We have the National Patient Survey, etc., etc. Well, the good news is, and as being a hospital doctor, you'll appreciate this, they trialled the friends and family test in hospitals. They tried it on hospital doctors first, because let's face it, let's try it on them. They're the guinea pigs. If it works, we'll bring it back into real care, i.e. primary care and general practice. So the friends and family test very simply asks every patient who receives care, would you recommend the care you've received to a member of your friend and family if they needed it? It's a bit of a long sentence, because that's what happens when the Department of Health creates a short, snappy survey. Have to be careful, I'm sure I've got colleagues here. But essentially the aim, and it was originally the Prime Minister's idea, partly from his experience of his family and his family journey, the aim was to get the experiences of our patients and their families in real time and in a comparative way, so that people can actually say, yeah, the experience of Luton Hospital is fantastic. The experience of Milton Keynes maternity, that's getting better and better. Or the experience of people whose children are looked after in Oxford isn't so good. What's going on there? Actually, I don't think I want my family to be treated there. I'm going to go there. So the aim was to give information to the public and the patients, and we're all public and patients, of course, that would empower and inform them, and ultimately give them a little bit of leverage. Say, actually, that practice there seems to give a fantastic experience to families who've got children with asthma. I think we'll go there instead of to that practice. Or that practice looks really good. They've obviously got a real interest in dementia. I'm going to register there. So it's not about simply good and bad. It's about helping people find the best care that suits their needs. Because as we all know, I'm sure, I don't know how many of you would admit it, but I'm sure pretty much all of you, if you're like me, if you move to a new area, you choose pretty carefully which practice you registered with. If your child or your parent needed to go into a hospital, would you accept any NHS hospital and any NHS doctor or surgeon, wherever they happen to be, without even finding out whether they were good or bad? We all know there is huge variance in the quality of care. There's huge variance in efficiency, there's huge variance in clinical outcomes and safety, and thankfully that variance is being narrowed and narrowed and narrowed, largely due to the work that the CQC is now doing. But there is still a real variance. I think, how many people here, if they were going on holiday to a place they hadn't been before, would use TripAdvisor to look up a hotel? Yeah. And how many people have ever looked at a rating on Amazon or eBay? Yeah. And this is what our patients do. Just one small example, and then I'll get to talk about the friends and family test. A 85-year-old man was coming back for his follow-up to see a surgeon. In fact, I can show you the surgeon. Let me actually... if this works. Okay. So, not the greatest picture, but he's a surgeon, so what can you expect? So Oliver, an 85-year-old man who'd had a Whipple's procedure, and for many of you know, a Whipple's procedure is it's a very invasive, aggressive operative treatment to try and cure pancreatic cancer, when they basically take out the pancreas and most of the small gut and most of the stomach, and it's hard. And this gentleman was 80 actually, and he'd had his Whipple's procedure 3 months before, and he came back to see Mr. Warren and to get the outcome. Just give you an example why you can read that, because if you get bored of listening to me. Let me just go down to... Where's the one I want? So, Mr. Warren is a surgeon who asks all his patients to rate and review him. Every patient, he's actually in Australia for a bit now, so he hasn't got so many, but he asks every patient to rate and review him. Family in front of him, an 80-year-old man who'd had the Whipple's procedure, and Oliver had to tell the family, the patient and his wife, that unfortunately the scan showed that the tumour had come back. And despite going through this horrendous operation, he probably had 3 or 4 months to live. And as he was telling him, the patient's wife, who I think was 75, leant forward and she touched his arm, and he thought, this is a bit odd, it's meant to be the other way, I meant to touch her arm. And she said, thank you very much, Mr. Warren. We knew you'd be kind, because she said, because I looked you up on the internet. And he was like, oh, well, A, he's 30-something, so he doesn't think anyone over 40 uses the internet. B, she didn't say, I've looked up Imperial. She didn't say, I've looked up the treatment. She said, I've looked up you. Now, because he's been asking all his patients for reviews, when you search Google and you put his name in, indeed, any doctor, and then I'll come on to practices, any doctor who's got more than 20 or 30 reviews on I Won't Great Care, it's the top hit, because Google loves independent ratings and reviews. So when she looked him up, that was the page she saw. And what she saw was the comments and words of other families and other patients who'd been through the journey. I use that as an example of the fact that what you know anyway, this is what the public do, this is what we do, this is what patients do. We expect to find information. We want to know not just what the glitzy website says of the hotel or of the GP practice, but what other patients say. It's a social change. It's a consumerization of healthcare that's unstoppable. And people will more and more and more, in their choice of where they go, which practice they register with, will be looking up on the internet to find information. So what's this got to do with the Friends and Family Test? So the Friends and Family Test says that from December the 14th, I think it is, as a contractual obligation, every GP practice has to be collecting, have to have a system in place to collect from every patient, and they haven't quite worked out the exact frequency, you know, if someone comes every day or 7 times a day, but essentially every patient visiting must be given the opportunity to rate and review their care. And that means they will have to answer the Friends and Family Test question, would you recommend the care you've received? And there's a sort of 5-point scale, which essentially we turn into stars. And then there's the free text, which again is mandatory. It's not optional. And the free text essentially has a leader question which says something to the effect of, what was great about the care you received and what could be improved? Now, the interesting thing is, I Want Great Care, we nudged and pushed and tried to help them make sure this worked. And as partly as a result, we now run the service for about 60% of NHS hospitals and the acute sector, and an increasing amount of community sector, because the Friends and Family Test is going into community mental health services from the beginning of next year as well, with the plan that the Friends and Family Test will go across all NHS services. So, as every practice will have to have a system in place to ask every patient. Yes, there's expectations around different languages, versions for people with reading disabilities or learning disabilities, and they're pretty robust about this, partly because the evidence from the hospital sector is it works, and in terms of it works, I mean the staff, the management like the system. Hospitals who've been running the system typically say staff morale has gone up, and that's because the vast majority of feedback is good, but equally importantly, there's very clear now that when organisations put this in place, they find it a powerful tool for learning. It's a real-time, active monitoring of the quality of service as seen through the eyes of patients. And this is about, so Hull, for example, a large hospital, large trust rather, in 6 months they found 633 things to change and improve as a result of the patient feedback. And they weren't a bad organisation, far from it. So for the Friends and Family Test, you've got to do it. You have to have a system in place. There's a bit about I Want Great Care, and I'll tell you what we do in a minute. Secondly, and I've had a number of discussions with both David Bean and Steve Field, it's about actively, continuously listening. So for the hospital inspections, I'm thinking about Hull and Swindon and many of the hospitals we work with. When the CQC team went in, the first thing the hospital said, here's the 10,000 pieces of feedback we've collected in the last 3 months. Here's all the action points that we've taken from them and the changes we've made. And when you come to thinking organisations using other systems of monitoring, third-party data, the views of patients, it's really important and really powerful, because as you've sort of probably heard already, and it'll become more and more clear, is it's not about just doing a little survey the week before the team come in. It's about showing that continuously, every day, every week, you have systems in place to actively listen to the voice of patients. And I think you'll find in the next few years, having a patient participation group that meets once a month, that may be all right now, but I think in the next few years, the pressure's going to go up and up and up. And I don't want that to sound too negative and sound like a stick, because as I say, it's very clear from every organisation that does this that it's simple, it's easy, it builds morale and support, it supports very effectively those practices that are trying to build their practice numbers. Because once you've got sort of 50, 100, 200 reviews, it drives numbers. But also it helps identify opportunities for change and improvement. I'll show one example of a GP practice who are sort of ahead of the curve, really. Because, as I've mentioned, you don't have to do the friends and family test till the end of the year. But some individuals and some practices are saying, hold on, we need to do this anyway. We want to do it. We want to listen to the voices of our patients. We want a simple, easy system to do it. We believe it's good for driving awareness and practice numbers. And to be honest, we want to be ahead of the curve. So Nick's the chair of the Doncaster CCG. Slightly better picture than the last one. One thing I'll come to, the system allows, if they want to, all the doctors to upload a picture of themselves. Whatever else you do, get control of those pictures. Because all your effort and reputation and brand building can go down the tubes pretty quickly. So Nick, as I say, he's sort of the chair of the practice, but he works there. So every doctor gets their own page, where they can write a little bit of blurb about themselves and put their picture up. The system works that patients and their families are asked to provide a separate, discrete review for the clinician they saw and for the practice. Because, of course, patients have different views, and the doctors will say, oh, I don't want to get the bad thing because of the parking or this, that, and the other. But again, it's separating. But the whole thing probably takes a patient about 60 seconds to do. They can do it on their phone, on a tablet device, on the computer, etc., etc. So Nick sort of got these reviews. 9 people found this review helpful. Really nice doctor. And you can see there's three scores for the doctor. How much for the patient? How much do you trust the doctor? How much did they listen to you? And how much would you recommend them? So he's got all these lovely reviews. Now, I have to be, again, very careful. Well, I won't be careful at all because I've got my car outside and can make a quick getaway. The doctors love it because they get lots of lovely things said about themselves. And as you know, obviously surgeons are the worst, but every clinician's got a little bit of vanity about them, a little bit of insecurity. Joking apart, it's nice to hear good news. It's nice to hear that all those patients go through, you make a difference, because too often we don't make it really easy for people to feedback. The aim of this system is it's so easy that everyone can and will. And then for the actual practice, so that's his feedback as an individual. They haven't put a picture up of their practice yet. The reception staff are always very polite, professional and discreet. I've been in with this surgery for 26 years and been treated with professional courtesy. I think they're great. Apart from computer problems, or listening to other people talk about their practice, I think this is the best. And you see people write a little less about the practice, and then the metrics are different. Would you recommend it? Were you treated with dignity? Did you feel involved in decisions made about you? Did you receive information? Was the room where you received your care clean? And were you treated well by the receptionists? And those particular questions, we worked with national groups of GPs and practice managers to come up with something that was fair, robust, and useful. The aim is not to provide a different questionnaire for every practice, because it's back to the TripAdvisor thing. You want comparative data. You want to know what your patients think compared to the other practices around you, or indeed national systems. So, how are we doing for time? We've got 10 minutes. 10 minutes. So this is quite reasonable. So, a system to make it easy for all your patients and their families to rate and review the clinicians and the practices. The clinician feedback also meets the requirements for the GMC revalidation, so the doctors tick that box of collecting their feedback for revalidation, including locums, temporary workers, etc. So all the clinicians in the practice get their feedback they need. Secondly, to meet the friends and family test requirement, because I Want Great Care is the largest supplier now, we have a sort of direct line into NHS England, and it's sometimes quite a contentious line because we push them hard and they don't always like to be pushed. And I'm absolutely terrible about this because my local MP happens to be David Cameron. So that doesn't actually do too much harm because Friends and Family Test was his big passion. So I've met him a couple of times, but more importantly, we meet with his health advisor teams. So when NHS England perhaps are going a bit slower, we have a nice little dynamic. So what we've said is, and through the LMCs, and Peter was one of the earliest ones to see the value of this and the benefit potentially, we've said that for this region and this group and a few others nationally, we will provide the service to collect all that feedback for GPs, the friends and family test requirement, making sure we continually improve it to make sure that the CQC say this is a good way of doing it. This helps organisations show they're doing what they should do. And we packaged all that up into a system, and we're providing it completely free of charge for 3 years to sort of your group and others nationally, basically where the chairs and the LMCs and where we've got senior buy-in and support. So, and when I stop and ask, you'll ask for where's the catch and everything else, so we can do that. But the service is, if people go onto the website and sign up before the end of June, it will be free of charge for 3 years. There will be no commitment or tie-in after that period. There's no catch. If people don't like it, they can leave. And we've also said, because it's just shameless marketing, that for organisations that sign up and start using it before the end of June and collect the first 100 reviews, we'll send you a sort of a Wi-Fi tablet. It's like an iPad but cheaper. And that can be used in the practice to collect the feedback. So in Nick's practice, they basically have the tablet on the, and I know you'll think, oh, it gets stolen. They have it sort of on the reception for people to provide the feedback. Couple of operational details. Patients can provide their feedback in the practice if you have a device, a tablet. They can provide it on their own phone, if they've got a phone, or they can provide it when they go home online. And what the practices do, you'll see, there's a whole sort of instructions and how it works and everything else. But essentially, you get your own URL for the practice, and people put that on everything. It goes on the front page of the website, it goes on reminder cards, it goes on appointment letters, and we provide little cards for people to be given and say, thank you so much. And it's incredible. The wording makes such a difference. And when people say, please can you help us improve the care for the next patient by giving us some feedback, and they've seen, perhaps there's a poster in the practice which we provide, they've seen it on the website, they've seen it on the reminder card, tick, 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 tick. People do. So TripAdvisor, which I mentioned, counting down the last few minutes, your coffee's coming. Stephen Kaufer is the guy who set up TripAdvisor. He set it up 14 years ago, and he's still the chief executive. This wasn't a sort of make something quick and make a fortune. And Stephen's wife died when she was 32 from a brain tumour, leaving 4 children. And so it couldn't be worse. So on the outside, his life looks perfect. Chief exec of a 4 billion business that's changed every hotel and bed and breakfast in the world. But tragically, he lost his wife. And I met him and basically said, you have transformed a sector. You have empowered the voice of the user, so there literally cannot be a bed and breakfast that's dirty, rude, or poisons its guest. Not purely because of regulation, but because of the power of the user. At the same time, TripAdvisor highlights and amplifies really great service. Whether it's the tiniest little bed and breakfast in Cumbria, they're actually on a par. And it's interesting. 12 years ago, hotels hated TripAdvisor. They were suing it. They were saying it will all be negative. How do you know it works? It won't be. But actually, as many of us use it, it's not perfect, but we know it works. So I said to Stephen, you've changed the industry globally. Our ambition is to do the same thing in healthcare. And cut a long story short, he's now senior advisor to the I Want Great Care board. The reason I mention it in this context is for a hotel or a bed and breakfast, if they're really into TripAdvisor, they really plug it, they do everything, if they get a sort of 3% response rate from their visitors, that would be excellent. Stephen said if they get a 5% response rate, we know they're cheating, because you can't do it. The average response rate for the hospitals who work with I Want Great Care is 40%. And when I told Stephen this, firstly he didn't believe it, and then I showed him all the data. He said, well, that's not just leading in terms of this, that's globally leading in terms of response rates for user feedback, for service feedback. And I think what it is, partly we spent 6 years trying to get the system right and making it easy. One, making sure people realise it counts. How many times do we ask our patients to do surveys and they never see the results? Every word that's written here goes up online. They can see their thanks up there. They can see when there's an issue. Number 2, it's that empathy thing. If you feel that your mum or your daughter or yourself was really treated with that little bit of kindness, someone took that little bit of extra effort, you want to say thank you far more than you do for a sort of a bicycle or a Venus flytrap. There's more Venus reviews for Venus flytraps on Amazon than there are reviews of brain surgeons at the moment. You think, they're probably very good Venus flytraps, but the point being here is people really, really do want to say thank you. But we need to make it really easy. And equally, if things weren't right, lots of patients want it to be put right for the next patient. Of course, because we don't have systems to capture that, all too often we only see the really upset, the really angry patients. Which brings me to my final point, which probably anticipating a question. We have systems, which again have been developed over 6 years, to keep out campaigning, libel, slander, that one patient who's convinced that I killed their mum on dialysis or whatever it might be. We have systems to keep that out. So if you review Nick Tupper and then you try and review him again within 4 months, it'll say, oops, we noticed you've already reviewed him. So I can answer questions about that in detail, but it's really important that the system is fair and open for patients and their families. When things weren't right, they should be able to say in an open public way. And when they were good, it should be equally easy for them. Final thing, just because it's a sort of TripAdvisor type thing, is you have, as a practice manager, the opportunity to add a response. So when someone says, you know, whatever it might be, the car parking is just ridiculous still, whatever, you can say, well, actually, we're working on that, that's known. Or if someone says, some practice managers now add responses to good comments as well. Just then you've seen that on TripAdvisor, saying, thank you very much, I'm glad it helped. That sends a message out to the next people coming and thinking about registering with your practice. So I covered an awful, probably lot, 2 months. The final bit is if you want to, use I Want Great Care for your friends and family test. And if you haven't been yet, you will be bombarded in the next 6 months with organisations trying to sell you something to do this. I am slightly biased, but it won't be nearly as good, but they'll also ask you for money. And I know that because in the hospital market, where we have 60%, where the hospitals do pay us, they're now getting about 25 companies approach them every 2 months with solutions for friends and family test. So there's a lot of organisations think they're going to make a lot of money out of this. My passion, and the reason I set this organisation up, is because I believe if we capture patient feedback properly, it will transform the quality of care, it will improve the morale of staff, and it will reinforce the great value that the public have for the NHS and for all the hard work you do. Final bit, if you want to do it, register before the end of May or June, and it's free. On iwantgreatcare.org, there's a button there that says register, and it even works. And then it says, if you're the doctors can register here, and if you're the practice manager, you register there. So you click on that. If I click the button, there we go. And it basically just asks you to put your details in, confirm your practice, and then off you go. So thank you very much for listening. I hope it was relevant to what you're doing now and what you're going to do in the future. And I obviously welcome any questions. Thank you.
Yes, hi, Sarah from the Elms Medical Practice in Harpenden. It's more of a comment than anything. The difference, I would say, with TripAdvisor and something like this is that with TripAdvisor, someone's gone to a hotel or restaurant and they could come from anywhere, from all around the country. So you get a broad spectrum of different types of people going to one place. The trouble is, with practices, we just have our patients of a certain area, and you will find that the expectations of patients in certain areas are very different from others. So what I'm saying is, if you're comparing Hertfordshire practice to, where do I say? But
somewhere else.
Somewhere up north, or I don't know. But the expectations of certainly our practices within Hertfordshire are quite extreme, and the demand is, I would say, very different and great. So I would just say that would just be the only comment of this sort of thing compared with TripAdvisor. But it's just a thought.
Yeah, no, I think you're right. I mean, the point you're making is you can only do your best to meet the expectations that your patients have. And that's why what we're doing is make sure you'll be able to compare your results with others in the area. Because it is an interesting challenge.
It's an interesting challenge.
Hi, Neil. It's Bimal from Lister House Surgery. How does this differ from NHS Choice? I know you can't put photographs on NHS Choice and so forth.
Yeah, so NHS Choices, well, one, I don't know if you've seen it, you'll probably find if you look at your entry on NHS Choices, most practices say to me it's mainly complaints, or at least half complaints, which doesn't represent your patients. Not half your patients are unhappy. I'm sure they're not. On I Want Great Care, we get typically for a practice 97% highly favourable comments. So we believe it's much more representative and fair and realistic. Secondly, as you pointed out, I Want Great Care also meets the needs of the individual clinicians for their revalidation feedback. The friends and family test actually NHS Choices doesn't do. It doesn't ask that question. It's not set up to do it. Thirdly, we really focus on making it much, much easier for patients. I mean, you know, I think if you ask the civil service to create Google or create a TripAdvisor, you get what you expect. And the response rates on the choices are low. Because I don't know if you've ever tried to sort of add a response. It's quite hard. So, for example, we make it really easy, different languages, different versions. So it comes back to, one, really understanding and making something that's useful for you as practice managers and for your clinicians. Make it incredibly easy for patients. For example, we provide you a little widget with code. If you want, you put it on your website and it shows the latest reviews in real time. And we're continually doing it. So our focus is purely 100% on collecting feedback from patients and their families in a way that's great for clinicians, great for practices, and great for the public. We don't do all the other stuff that Choices does.
Sue Elliott from Leighton Buzzard. Are the comments anonymous or?
I can't see you.
I'm here.
Oh, there you are. Hello. You were anonymous to me there. When people, they're confidential.
Right.
So you'll see on the reviews that you can't see, the doctor can't see, the practice can't see. Who wrote it, but when people add their review, they have to put in an email address, so we know who they are. It's for two reasons. One, to stop people just, you know, there needs to be a closed loop, so people can't just write anything. Secondly, it's part of the system we have to prevent abuse, because that same email address is linked, and they'd have to create other email addresses. There's other parts of it as well. And thirdly, it's so that messages can go back through a sort of us, an independent intermediary. So if you added a response to this saying, thank you very much for your feedback, it's really helpful, it's going to help us improve and submit, it's shown on the page below the comment, but it's also emailed back to the person who wrote it.
I notice also that there's a report this review,
Yeah.
and I guess that if you've got an issue with the review, you can report it straight back to you. Neil, is that true?
Yeah, so if you click report this review, there we go. And it basically says if this was inappropriate, give us your email address and report it. What we do is we take it off immediately until we've looked at it, so it's immediately removed. The other thing we do, I should have mentioned it, for the practice managers, when you set up, you put your email address in and you can choose to have every review sent to you in real time, once a day or once a week. Because the key thing is that you should know what's going on. By the end of the summer, there'll be a system to say, only send me a review if it's got negative words in or it's got a low score. So the aim is that you're on top of this, you know what's going on, you can respond. Although, as I say, the vast majority will be positive.
So when 40% of your 10,000 list size answer within a week, you could have a big email on your desk.
You feel very loved.
Yeah. There was one more question there, wasn't there, Carl? And then I think it was time for coffee.
Janet Griffin, Pemberley Surgery, Bedford. This is all aimed for online. What happens to those patients that come through our doors that don't have access to be able to go on a website? How do we address that? Or patients that can't read things on a website? Is there a hard copy version?
Yeah, so we don't, for the free service, we don't provide offline hard copy because that costs. The answer to the first part of the question is the tablet device in the practice. Works very, very well. That's why we're sort of giving them away once people get started. But it doesn't need to be an expensive device. In Hull, the hospital, they just bought 30 devices at £70 each. So, and that's across the ward. So one, a tablet device, and there is, and it comes to your second part, on that there is a version for people who've got visual impairment, and there's also a version for people who can't read, so it actually uses pictures instead. And of course, for the simple question, would you rate it? How would you rate it? It's smiley faces, sad faces. So, yes, it's great when people go home and do it, or they do it on their phone. But for people who haven't got internet access, the tablet device in the practice is the way forward.
What about different languages?
Yeah, it's available. It works on the tablet device. There's a flag drop down, and there's sort of, I think, 9 different languages, and that will soon be on the website as well.
Last question.
Hi, you mentioned you had a widget that you can show stuff real time on the website. Can you also use that on your waiting room screen?
Yeah.
So if you want to show people what there is currently being said about your practice.
I love that because that's what we designed it for. Yeah, so a couple of the hospitals do that. They have it on the big plasma screens when you walk into the foyer. So if you've got screens, it'll work exactly on that as long as there's internet access. And the thing about that is it really increases your response rate because people are sitting there looking and they can see the comments. So when they're asked, they realise it makes a difference. So yes, that widget can be, you can use it for anything you like.
I'm concerned we're now eating into coffee. I'm being really urged, Carl, for one last question at the very back, and then we will have coffee.
Neil, I've just been online and had a look. It looks fantastic.
Thank you.
What's the catch? You're a businessman, so there's no adverts on there.
Yeah.
Well, how are you making money out of it? Are you going to sell our details too?
It's the best question. I'm surprised you're all too polite to ask it first. So I am running a business, and as you say, I've got sort of now we have 28 staff. We have 48 by the end of the summer, and they all need to be paid. In fact, the person who's just joined us was a practice manager, and she's just joined, so that's really exciting. There's no catch in terms of, so for general practice, there's no charge for 3 years, and to be quite honest, I don't think there will be after that period. Why? One, because it doesn't, once you get the whole thing set up in the system, it doesn't, because it's online, it doesn't cost us a lot. Two, we're not, the business model is, we want to build over 5 years a TripAdvisor for health that will become the standard, so that you wouldn't think about registering with a new dentist, you wouldn't think about having an operation without seeing it, and that needs lots and lots and lots of reviews. So providing this service for general practice builds up our review database, builds up our credibility. The way we make money is we have a separate service for CCGs to help them meet their requirements, and they pay us, so Cumbria pay us, that's one CCG. Hospitals pay us, community and mental health service providers pay us, we charge a lot less than anyone else, which is good. And now we've got contracts, we've got our first contract with a private sector provider, but I aim to get contracts from all the private sector providers, and we will charge them a lot. We also have an international client now. We collect feedback in 18 countries and 14 languages for an international, they're actually a dialysis company by chance. Going to them, when we do our business development to other groups and saying 50% of the NHS users, they go, oh right, we'll use you. So the catch, I suppose, the way we're using is one, the public site will always be free. There won't be any adverts on it because I am a businessman, but I'm also a doctor, and I believe we can improve the quality of healthcare. And the second side is by having lots and lots and lots of NHS organisations use this, it makes us easy to sell to providers, commissioners, and then the private sector.
Neil, thank you very much again. Are you
Pleasure.
staying for coffee?
Yeah, I'd love to. Thank you. Thank you.